Okay, so let me pull up the document for the follow-up.
Okay, I will also send you my questions.
Yeah, okay. You have questions unrelated, more questions than this
Ah,
document?
yeah.
Okay, all right. So let's say last time we talked, the focus was really to pay really close attention to things that can raise your blood pressure, especially emotional things. And then we talked about experimenting with different antioxidants you can tolerate to start, improving your vascular health. And it seems like you've been doing that. And then if you could find any emotional triggers for your allergens. And then we talked about doing the sinus irrigation to kind of see if that will help some of your allergen issues. And then essential last point, which parts of your treatment may fall. So it looks like you were able to increase your antioxidants, right? Pomegranate, blueberry extract. You tried to do some pulse electromagnetic frequency, but it seems like mixed.
Yeah, that was a disaster.
Okay. Working on minimizing stress. And then the second thing we always ask on a follow-up is which parts of your treatment protocol have you followed? If you follow the protocols, sounds like it. Do you have any lots of persistent symptoms? Okay. And then new itchy, scalpy skin on face, new itchy.
Right over here in this area started after a session of photobiomodulation.
Oh, really?
Yeah,
That's very interesting.
everything is interesting with me.
Yeah, I mean, I've never heard of that, but everyone's unique. Okay. And then, here as we go through, like when you say a lot of persistent symptoms, those are just the neurological symptoms and the signature attacks that you had.
No, no, yeah, that's true, but there are so many other symptoms. It's yeah.
Okay. So, let's go through a couple things first. Are you still monitoring your blood pressure?
I do, but just here and there,
Okay.
not consistently, like 6 times a day. It's like once a week or something.
Okay. So just to kind of recap some of the concepts we've been kind of focusing on as a treatment plan, as like a strategy, um, you know, concerned that these that these are little microvascular insults that you're having when you're having these signature attacks, and those are directly related to blood, could be directly related to blood pressure. And I think when you noticed some relationships last time we spoke between getting on a blood pressure lowering medication and things that were triggering blood pressure to be high, and some of these signature attacks being a factor, right? And that's why we said really pay close attention to any emotional stressors you have. And then when I was looking at your paperwork here, two things popped up to me: possibility of having traumatic stress illness. And to be honest with you, I'm not really sure what traumatic stress illness is, but I would assume it's trauma relating to downstream effects long term. Is that correct?
Yeah, yeah. I'm asking in my question there because I did take a course on trauma healing accelerated by Dr. Apigan.
Mm-hmm. Oh yeah,
Um,
yeah.
yeah, and she's talking about it, and that's what made me think that maybe this is really what it is. All along, we have been noticing that my symptoms are very much related to response to stress.
Yes. So I think that some of the strategies, and not familiar with all of them, but she's great, and those types of things may be very beneficial to you. You won't, obviously you're experimenting, which is great, but I think for me, like ultimately, yes, anything that raises your blood pressure, and certainly emotional traumas or stress or autonomic changes can do that. You seem to be very, very, very sensitive to what's happening with the Ukraine, obviously, with family and loved ones. But with blood pressure being such a delicate thing for you, um, if you have any way to cope with it, if you have any way to deal with the stress, so do you find it to be helpful at this point or no?
Yeah.
Oh, wonderful. That's wonderful. That's very great. Okay.
She actually gave me the information I've been hunting for many years. I really appreciate that course.
That's wonderful. Okay. Then the second thing I want to go over these quickly here. Then we can go deep into your questions and kind of make sure we're on the same plan. Understand if I do or not have autoimmune disease. So when I went through your file, and just looking up everything before the call, you did have auto antibodies to myelin basic protein and aquaporin 4 in the past. So those are neurological autoimmune target proteins. Now, that doesn't necessarily mean you have full blown autoimmune disease, and you probably don't fill the criteria of autoimmune disease because you're not showing white matter lesions on your MRIs. All you're showing is these microvascular little lesions. They're kind of little dots everywhere, and like things like demyelination or bigger spots. Sometimes they're hard to distinguish between one or the other, but you may not like fit the criteria for like myelin basic protein is associated with multiple sclerosis. I don't think you would fit the criteria for that based on your any of your imaging studies at this point. And then your aquaporin 4 are really related to neuromyelitis optica, where people would have like severe visual inflammatory responses, and they see color changes, and they can lose vision and have very acute visual symptoms like that that you don't have. So you have some of these autoantibodies that are neurological, but it doesn't seem like you would fit the criteria.
Let me ask you though, like in this Cyrex test,
Mhm.
autoimmunity array 5,
Yeah.
they also test here for myelin basic protein, but no, it is negative here.
Yeah.
So we have kind of like contradictory information from
No,
Vibrant America. It looks like this is a problem with myelin basic protein, but with Cyrex it is not.
yeah.
So
So
and
that's
I
the
think that you prefer Cyrex, right?
well, I prefer it's not one lab or the other. I prefer the methodology Cyrix uses, which is the gold standard. I think the other one he did was Vibrant, which they use a microarray assessment, which is an algorithm with the low dose antigen to see if it's there. So if I had to pick one, and if anyone looked at the evidence and picked one, they're going to pick the Cyrix test because it's the gold standard, and the other one is a investigational type of testing for antibodies. But they showed up. You're right. The aquaporin 4 myelin-basic protein showed up in that one in the past. So the testing itself could be questioned because it's not the gold standard. The accuracy and sensitivity is not reported by them. A lot of times, if you do algorithms by lab using microarray, you can list. You're supposed to, it'd be nice for people to know. We found our microarray for myelin-basic protein was 80% accurate to the gold standard or 40% accurate. They don't list those things, so no one knows what they really are. So I think it'd be hard to really determine if you have any autoimmunity. I don't think that's your main issue. I think your main issue is just the vascular health. That's the compromise. That's the big issue, and it's been
So
confirmed.
I want to be really clear on the diet. So I do not need to stick to autoimmune diet.
Yeah. So I mean, our initial goal was to basically have you on a ketogenic diet for neuroinflammation,
I
and
didn't work.
yeah, and then of course that wasn't working for you. And then the goal was to kind of then just kind of shift you into low antigen anti-inflammatory diet in general, just anti-inflammatory being key issue because even with microvascular disease, inflammation is a trigger. So whatever diet that works best for you, and we also know insulin is a trigger, so we don't know like basically a healthy non-inflammatory diet that works for you is going to be the diet to go for. You also had some issues with your gut and bloating and sensitivity that you've been dealing with for some period of time. So you had some SIBO tests that were positive, which kind of puts you more like on the FODMAP category of kind of how your diet has to shift, and ultimately some experimentation to kind of to see what works best for you. My initial goal with the diet was really most to see if we can get you in ketosis and get your brain inflammation down more than anything. But sometimes people don't respond to it and you can't do it. And the second concern for me was like the microvascular disease and the blood pressure to the point where like you really have to consider medication and really look at these blood pressure triggers as the main issue. As far as your diet is concerned now, as long as it's not driving insulin, as long as it's an anti-inflammatory and it works for you, and it's not triggering your SIBO, that would probably be fine. What have you noticed with your diet?
Well, I don't really notice any reaction, but it is hard for me to figure this out because my symptoms is kind of going up, down, up, down, up, down, and I think, okay, I'll be watching this for, let's say, tomatoes, right? Not supposed to have it on autoimmune. Well, I have what, which is lots of tomato paste. I think I'm reacting. Then I'm eating it next time. I think I'm not. So I'm not able to figure these things out.
I know, and the difficulty is you have. I'm just going to assume the diagnosis of microvascular disease is accurate, and that's my working diagnosis, and that's what 3 MRIs have showed. And obviously, some people have micro. You have to understand why it's difficult for some practitioners to understand that, because you could have two different people that have the same degree of MRI change with microvascular disease. One doesn't have any symptoms yet, and one has severe symptoms. And part of the reason is because for some people, they get the injury, but their anti-inflammatory, antioxidant system, their microglial cells come in there and really just dampen it, so there's no really main clinical expression. And some people don't have that compensation. So just because a little change happens in a microvessel, has a little tiny rupture of a small branch, for a lot of people that will be asymptomatic until they get really, really progressed. For other people that don't have the compensation, it can be more symptomatic. So there's a whole scale of people that could have microvasculars at different stages with whole different degrees of symptoms. Okay, with your acute onset of symptoms and your MRI findings, and the acute onset being clearly neurological, every time you have them, you have these patterns. That makes sense, but I could see why some people wouldn't jump to that diagnosis because you're much, much more symptomatic with your microvascular disease than maybe other people may be for various reasons we may not totally understand. When I was looking through, your case history, the problem with like finding foods that may be associated with it, or like you put like when you had you took HPA balance, which is a supplement. I had to look it up. It looks like it was just basically adrenal adaptogens, but you took.
It is not just, you know what it has there? It has L-theanine.
Yeah, I
And
looked.
I thought, because I should have told you that, except that I didn't think it through, obviously. I had a disastrous reaction to GABA,
Yeah,
and I shouldn't have, right? I should have been calmed. It was the other way around. I got such severe insomnia. It took me a long time to figure out that it was that supplement. So
yeah.
I stopped it and I kind of came back to my normal. So
Okay.
do you think that L-theanine that is in that same realm as GABA could have been doing that to me, aggravating me?
Yeah, I mean, L-theanine binds to GABA receptors, just like if you took GABA, and GABA normally wouldn't have any effect unless the blood-brain barrier is breached because the molecular weight of GABA is so large. It can only cross a breached barrier, but with microvascular disease, there's a breached barrier. So, and GABA is typically like inhibitory, calms people down, but there's pathways in some people that get injured, and GABA can inhibit inhibition, which then cause excitation. It's like all the neurology, they call it disinhibition, all that stuff. So I think it's very real that we see it all the time in people that take GABA, L-theanine, or some kind of GABA agonist like valerian root extract or something like that, passion flower extract, and then they get these anxiety symptoms. But for you, anything that raises your blood pressures is not good, as you know. So like this adjustment, why are you still getting adjustments? Because you get tight.
Well, obviously, you're a chiropractor,
Yeah.
so they do this X-ray. They see in my atlas. I used to have a lot of pain, discomfort in the back of my head, in the brainstem area. I don't have that much anymore. But then I go to the chiropractor, and you're not supposed to, your atlas to be going out of where it's supposed to be. Well, mine still does. I've been doing this for a year, and what very often happened in the beginning, I would have my signature attack, right? Like go there in the morning, in the evening, I have signature attack, right? So too much of a shift for my body, too much of a stress. And every time I would go, it needed to be readjusted. Now I don't have to have it readjusted that often, but I still do. So they tell me I need to keep coming, and I don't know any better.
Don't go.
Okay.
You can't do anything that raises your blood pressure. Even if getting a hug raise your blood pressure, we don't want you to get a hug. Okay.
Okay.
It's like this is the problem with manipulation. It's not. It's just that for many people, it just spikes their heart rate up really quickly afterwards. And anything for you that's slightly well, not anything that triggers your heart rate or blood pressure to go up is always a concern. So I don't know. I mean, if you have events in the past that trigger the signature attack, just don't do it. Now, this HPA balance you took, did it actually cause a signature attack or just cause you to have anxiety?
Oh no, it's just a signature attack.
Okay. All right. So then we can see.
With gamma, I did not have anxiety. It just increased my symptoms, pain, insomnia especially. I do not have anxiety. I never feel anxious.
Right. Yeah, I know we had this sensory discrimination disorder pattern we identified, and I think that's leading to a lot of like perception of chronic pain that may not relate to tissue injury, but it's just there because your brain's perceiving it.
I actually really appreciated that suggestion you gave me about my pain being centralized, and I looked into that deep. I learned more about it. I think you're right.
Makes sense. Yeah. Okay. Well, I mean, ultimately, the goal is to get your blood vessels healthy, your brain healthy the best we can, and then also at the same time reducing anything that's raising your blood pressure, causing attacks. So, are you? So I think this traumatic stress illness program that you've been on that's helping emotion. That's really fantastic. But still making that relationship between emotional triggers, lifestyle triggers that raise your blood pressure, cause an attack. Because at some point, you want your plasticity and connectivity to be greater than the microvascular attacks. That's when you shift. Now, when you sent this brain region, when you fill out these forms, I can tell you I looked at this brain region localization form and just compared it to your initial one. And there's some improvements in many of these things to the left. Certainly things have not gone worse since since we searched together. And if anything, some of these have gotten better. The sympathetic stress response was exactly the same. Like you're still very sensitive to that. But your frontal lobe symptoms, your medial temporal lobe symptoms on this page, on this page here, these were most of these. There's lots of 2s and 3s before. They're down to 1s and 2s. You look at your original form, and then these were much worse, associated with memory and dysfunction and those things. So, and then also muscle endurance seemed to be improving. Just comparing form to form over time, which is just kind of a way to make sure things aren't going the wrong way and what the outcomes are. I'm not saying you're cured or reversed, but at least you're definitely not getting worse. And if you can slow down the trigger and then shift the weight into more neuroplasticity, neuroconnectivity than microvascular, flare-ups, then I think that would be, the right direction. Okay. So these are the signature attacks. Yeah. And then do you think you think the pulse electromagnetic frequencies is causing a problem for you or not?
Oh yes, big deal. I'm going to talk to Dr. Pavlyuk next Wednesday, so I'll have his opinion on it. But I kind of expected, because I read his book, and he describes that people with electromagnetic sensitivity might be reacting to it, and that you are supposed to go very slow if you are sensitive to electromagnetic frequencies. So I did start kind of it was pretty much nothing. And I thought I would just go doubling it, starting with seconds shouldn't be a big deal. Yeah. But it was after the third, like I described here. Yeah. So I will have to develop a strategy here. I mean, this is $14,000 I paid for it. I'm determined to make it work, but it has to go very slow,
Yeah.
and I'm going to dedicate several months now to very, very slowly and methodically increase the dose. And hopefully I will get support from Dr. Pavlyuk and his team, and we'll see where it gets me.
Yeah, that's everything brain rehabilitation wise, you go to the level that a person can tolerate and then you back off. And then typically the things that cause the most severe reactions are really the things they really need integration with, it's a little bit different with different activities in PEMF, but I think it's good for you to do that. Ultimately, you have to find as many different strategies through trial and error that can help your brain function improve. If you're already invested the time energy for the PMF, you might as well go along with that,
Except that they say they are making sadomasochist out of me, because I have to go to like fall apart and all over again.
Do you think there are continued strategies you can focus on to keep your blood pressure down throughout the day?
What do you mean?
What's that?
I did not understand the question.
Oh, I'm sorry. Do you think there are some other strategies that you may not be focusing on related to your blood pressure and your emotions that you can incorporate more often to help you?
Not that I know about.
Okay. You mean you're not watching the news all day and getting stressed out? No.
No. I'm on my feet working around the house in my garden. This is where I feel my best. This is outside, I feel my best. Working in my garden, I feel my best. And I have like half an hour to an hour in the evening as I'm doing my puzzles. That I'm listening to news. That's it.
Okay. And then the other thing I forgot to go over that you put on here was the exercise. So you were doing exercise. You doing high intensity or no exercise?
No, not high intensity. I have stopped even walking every day because of my knee, right?
Yeah.
So it's like whatever I start, I have something else explode on me. Okay, so I started dancing. I
Oh,
and walking more and more, and then my knee started aching. So now I am doing the therapy to rehabilitate the kneecap. So okay, can do dancing. Don't. Well, I'm going. I think because now I started that therapy, I'm going to slowly start the daily walks again.
yeah.
But this time everything backfires on me. I start this one and it tears in a different spot. I start this one, it tears in a different spot. I think there's obviously too many systems that have been damaged. That's how I can explain that. But yeah.
I know that's frustrating. So with your knee, you were diagnosed with mild osteoarthritis, you said. But it's still like you can start walking in though, right? You said you can, or
I did. I was till see it. It took me a 2 or 3 months before I could see the doctor, and without the doctor, I don't understand. Am I aggravating it? And I'm not supposed to when I'm walking every day and dancing, or is that something that I'm supposed to do?
right. Well, typically the if you're not dramatically altering the stress of your joints in abnormal ways, and you can work out to the point it's not completely swollen the next day,
It does not get swollen at all.
yeah, then the more movement you have, the better. Like lack of movement, like you have to move. You have to.
I do, like I say, I'm moving all the way. I go to rest about 2:30, 3:30, depending upon how I feel. But I get up, and this is what I wanted to tell you. You might want to hear that. This is the first summer that I've been able all along to be getting up like 7 o'clock in the morning. I had not been able to get up from my bed. I would be up like 3, 4, 5 o'clock. but I'd be staying in bed till 9 o'clock, till I master enough energy, till I obviously get enough cortisol or whatever.
Mhm.
But I've been able this summer to be up at 7, so I get up and I'm on my feet, moving, working, cleaning, washing, cooking, gardening till afternoon.
Right. It's all therapeutic for you. You need to, that's
Yeah,
all. It's
that's
like,
what I really do.
okay. Now, the other thing is like when you look at microvascular health, so the key things are basically reducing inflammation. We talked about having to try different flavonoids, and you're very sensitive to various supplements, but you were able to tolerate pomegranate and blueberry extract, correct?
Yeah.
Okay. Are you continuing to try different ones, or are you trying to increase the dose? What are you doing?
No, no, I got, this is my food, right? And my food is very rich in antioxidants. Like right now, blackberries are ripening in Northwest. So we are having lots, we are picking them in the forest and we are eating lots and lots of blackberries, antioxidants, right? Then blueberries, I have smoothies all the time with blueberries, but now I got the extract, right?
Yeah.
So I'm adding it to my food. I'm not taking it as a supplement,
Okay.
right? But I have smoothies every day, and I have pomegranate extract. I have blueberry extract. I have dried blueberries, dried wild blueberries. I have wild blueberry juice. So I really have all this, quite a lot of it.
Okay.
And I'm eating lots of vegetables and fruits.
What about like fish oils, fatty acids? Are you getting any of those?
Yeah, this is actually one of the questions I wanted to discuss with you today because we did try the fish oil and then you told me to stop it and we did the test and you asked me to be taking omega 6s, right?
Yeah.
Yeah, so I was doing that, but now I ran out of that. And I didn't know whether you would like me to continue that. You did mention that we need to be doing it for a while, but you didn't tell me for how long is that while. So my question is it time to do the test and see? Or will you tell me for like January, May, when would you like me to do that test? So we evaluate and see whether I replenished my omega 6s because we want the balance, right?
Yeah. Yeah, we could do that test now. I mean, we could repeat the test now. It's just the essential fatty acid profile and see if your ratios are more in balance with each other. I mean, ultimately, at the end of the day, like there's always two battles here. One is to reduce things that flare you up and cause attacks. I think for me, looking at your timeline, I think getting on blood pressure medication was a big positive step for that. And still, with blood pressure medication, you can still have spikes with anything that's emotionally triggering you, so you still have to keep aware of that. And then now is like that maintenance that some of that direction has been focused on that. The goal is now really to protect your blood vessels and health, and working with fatty acids and other things could be really important. So with blood vessel health, we definitely want a few things to support that. Antioxidants, we want proper essential fatty acids. We can repeat the test, but in the meantime, you can just you can either try. Well, we can get the test done for you, like let's say in the next week or so, and just get the results back and see where you are with everything. But you still want to make sure you have some balance of fatty acids in your diet, healthy fatty acids all the time.
Yeah,
Yeah,
I'm taking flax oil like you told me all the time. I'm not taking it like by a tablespoon. I eat it in salads. I eat salads every day.
yeah,
So I add some olive oil, but also flax
yeah,
oil. I have it all the time. I also grind my own flax seeds, and I keep adding that to the smoothies.
yeah,
So yeah.
yeah. I think let me take a look really quick here in your file. Um, yeah, yeah, you're right. Your omega-6 pathways were not working very well. You didn't have many omega-6 pathways. Okay. Yeah. Okay. So we can see if those are balancing out. And then the omega-3s you were okay with, but you're still eating a diet like you were before with omega-3s in there, right?
Yeah, we eat fish and seafood
Yeah.
constantly.
And I think I think when you look at your case and but not forget your past, because your past you're so reactive to various supplements. It's like, of course, there's so many things you can take for your blood vessels to support you, but so many of them you've had reactions to. Like I remember you had a reaction to one of the things I love to use is nitric balance, which is I think
I am using nitric
you are
balance.
using that.
Yeah, I didn't put it in because I'm not using it like 3 times a day. But every time I go out to exercise or I'm doing something outside, now lately that I have not been working regularly,
Yeah.
I take nitric balance with hydrogen water. I got that
Oh,
bottle
great.
hydrogen water, so
Perfect.
I'm taking that. Yeah.
Okay, great. So when did you start back on the nitric balance?
Oh, quite a long time ago. I don't know, maybe 8, 9 months.
Okay. For some reason, maybe I'm confusing your file that you had a reaction to that, but that's one of the best things you can take.
No, it was something else that I reacted to. It was something O2.
Neuro too.
Yeah.
Okay, that's what it was. Oh, but okay, so that's great. You can take the nitric balance and not have any reactions with it. Okay, so if you have like a nitric balance is things vascular endothelial factor supporters with vinpocetine, which is fantastic. Have you ever been able to take hawthorn extract?
I did buy it, but kind of scared to take it with all these reactions. I kind of like right now my priority is to master PEMF.
Okay,
So I will not be throwing things into the mix at this point because I want to get somewhere with that. When I either give up on it or I succeed with it, then would be the point that I will start
fair.
experimenting.
That's fair. That's fair. That's a good way to do it. What about magnesium?
I'm taking lots of magnesium because constipated, right?
Yeah. No, I mean, when you look at the high blood pressure and vascular health, antioxidants, flavonoids, healthy amounts of fatty acids, things that raise nitric oxide, and magnesium are like on top of the list.
Yeah,
So those are.
I'm doing a lot of that. Yeah.
So, did you have some questions for me as well?
Yeah, like, can you see it in the chat? I put down the questions.
Let me make sure you can share. Can you share?
So we did discuss the first one, right, about autoimmune
Yeah.
diet, and I don't have to worry about that. Looks like. So the next one is about this trauma. I really like Dr. Schwartz, and I was wondering whether you know her, and whether you'd be willing to ask her whether she could help us.
I don't know her. I'm sorry.
You know. Okay.
Maybe Dr. Appigan knows.
Well, I don't really talk to her. See, the way she arranges her classes, everything online.
Oh, I see.
And yeah, well, she does have it. She doesn't really take questions during her presentation.
Yes.
And
Okay.
yeah.
Yeah, I'm sorry. I can't help you with that. I don't know the numbers.
Yeah. So then about antioxidant intake. So
Oh, I see. I understand your question. If you pull it down a little bit, uh, there you go. Okay, so if I understand, CRP said ER are good at what their other markers. Okay, so you have to understand like things like C-reactive protein and endothelial, like ESR, erythrocyte sedimentation rate. They're really looking for systemic inflammation. Like if you had an infection, they would be up. If you had a really severe inflammatory bowel condition, they'd be up. If you had uncontrolled diabetes, they'd be up. But what's happening at the blood vessels are not going to always reflect. And when you have any kind of, uh, let's say, it, in your case, it's, let's say, microvascular insult, any kind of insults like that. Those are creating a state where you want to have anti-inflammatory natural compounds to help recovery. It's not that your body is, let's say, has high degrees of inflammation that would raise those lab markers, but you want to have those things that protect the blood vessels. They also, find consistently blood vessels, the severity of injury to tissues and blood vessels, whether it's a stroke, whether it's a tissue injury from trauma, is greater when there's less antioxidants. And the more antioxidants a person has, the more tissue protection is, no matter what the insult is, whether it's vascular trauma or mechanical trauma. So it's just a protective role.
What do you think about this test? Are you familiar with this advanced oxidative stress precision?
These are just urinary markers.
It's actually both blood and urinary. And I really liked, because I looked at their sample report, and they kind of give you this supplement. Like if your glutathione is low, say reduced, they tell you what supplements to look more into, kind of like might help pinpoint what kind of antioxidants I lack. And I think you can do it through this test. I think I was able to find it. So I would really
well, if you're,
like.
yeah, if you have to just experiment with different antioxidants. If this test is helpful for you to figure out to try different things that you want to experiment with, by all means, do it, please.
Yeah, except that I do not know of these 4 markers. I would suspect that my total glutathione should be low according to my genetics, but if you're able to order that test for me, I would appreciate it.
Precision Point Diagnostics. I have to coordinate with Susan.
Okay.
I've never used this lab before.
Mm-hmm.
Like it's a serum. It's definitely your organic acid markers. And then it seems like some of it may be serum reduced glutathione. Okay. The reduced glutathione. We'll look into it.
Sorry.
Yeah, we can order for you. I mean,
okay, great. Thank you very much. I also wanted, because we are pretty much out of time, I also got this C60. It says ultimate antioxidant. Are you familiar with that?
No.
It is something very new, very expensive. I did get it, but I kind of, again, didn't try because I'm afraid.
Yeah.
And if it says ultimate antioxidant, what do you think? Should I try it?
I don't know. I think at some point you're gonna have to try different types.
It's scary with me to say yes or no, right?
You're so sensitive. There's always going to be trial and error no matter what.
Yeah. Okay, these are my questions, and yeah.
Okay, so I think we're pretty much on the right track with everything. I think my only feedback would be to really focus, make sure you're monitoring your blood pressure really well, and make sure when you have triggers, it's a really big deal to make sure you avoid those. Like if your blood pressure goes up after manipulation, you get a little microvascular silent, signature attack, then that's the thing you really have to be more concerned about than your atlas being out of place, and if that's even the right diagnosis. In any case, if you continue trying different supplements, you continue to move. I mean, ultimately, if you just think about the concept of reducing the high blood pressure signature attack flare up, and then optimizing your vascular health, movement, exercise, the supplements you're taking are doing it, increase your antioxidant doses doing it. And then ultimately the goal is just to make your brain healthier. If right now you're experimenting with the PM pulse electromagnetic frequency to see where that takes you, that's great. But there's just going to be this effort for me, probably for the rest of your life, to try to find different things that continue to improve your brain function. For the rest of your life, continued effort to keep your blood pressure down. For the rest of your life, continued effort to always be moving. Those are all the things that are going to keep you functioning, uh, at a higher level, and hopefully you continue to have, less bad days of flare-ups. And if you have them, they don't last as long. And also, you maybe notice some things over time, like like you can get up and out of the bed, like you weren't able to do that before. Those are just signs your vitality, your general health is getting better. So I think you're on the right track. When do you think would be a good idea for us to connect again? You want to see if we can do that precision point test?
Yeah, let's do
Yeah.
this with these two tests, the fatty acids and this, and
EFAs. And then
we get
when those come in, we'll talk again. In the meantime, make sure, obviously you're doing all the supplements you're taking, seems like it's fine, experiment with antioxidants. Your current supplements and diet include lots of different flavonoids. You've got magnesium in there ongoing. You have the vascular health things like the vinpocetine and the nitric oxide product. And then you're moving, you're exercising. So that's wonderful.
thank you.
Yeah.
Slowly but steadily, right?
What's that?
Slowly but steadily.
Yeah, absolutely. Fantastic. Okay, very, very nice to see you.
Thank you very
Out
much.
with everything.